A week-long international conference sponsored by the Alzheimer's Association took place in San Diego recently. It's an opportunity to learn more about cutting-edge research and new treatments for a disease that afflicts almost 6 million Americans and takes a terrible toll on family members forced to watch their loved ones fade away.
Peggy Killian, there was a lot of news that came out of your conference this week, including the role that ultra-processed foods can play in accelerating or perhaps leading to dementia. So list some of those foods and what the research is showing.
Potato chips, white processed bread, frozen pizza, sugary pops and breakfast cereals, etc. There are those foods that have been ultra processed. And as a result, there've been a lot of stuff added in, additives, artificial seasonings, flavorings, colorings, etc. And what the study that came out of the Alzheimer's Association International Conference this week showed is that individuals that consume a high degree of these foods are placing themselves for an increased risk for dementia. And actually, the study did show an accelerated decline in their cognitive function. Individuals whose diet was highly made up of these foods, which they identified as about 20% of their daily intake, that they had a 28% increased risk for accelerated decline in cognition.
Is it possible to reverse some of the effects by switching to a better diet, high in vegetables and fruits, or is the damage done once it's done?
The good news is that is being looked at. The Alzheimer's Association has a large-scale study called the Pointer Study, which is looking at not only diet, because it's really a combination of lifestyle factors. So it's diet, it's exercise, it's sleep, it's how much do you use your brain, it's how much are you socially engaged and active. It's all those factors together that are called the lifestyle factors.
Peggy, you're also discovering a possible link between COVID and the loss of taste and smell as an indicator of cognitive decline. Tell us more about that.
We've got COVID-19, we've got Alzheimer's and dementia. And I think researchers are trying to figure out what is the connection, how do they mingle? We got loss of smell, loss of taste. We have some brain fog, as people describe it. So for some individuals, these symptoms persist much longer. In particular, with the sense of smell, what we're seeing, at least in this initial study, is that it possibly is a better predictor, the loss of smell, versus how severe the case of COVID was that an individual had.
According to the Alzheimer's Association, minority groups are twice as likely to suffer from Alzheimer's, and that institutional racism is one of the reasons why. Can you explain that?
Black population is 2 times more likely. The Hispanic population is 1.5 times more likely than the white population to have Alzheimer's or dementia. Now we're starting to look more closely at racism and how is this all involved with it. So what we do know about racism is that it negatively impacts both the physical and the mental health of individuals that experience it. And we also know that racism is a trauma in the brain, and we know that it causes stress. And then we know that stress causes inflammation. And so we know inflammation is one of the risk factors for dementia. So it's all like this domino effect, where even though they're at an increased risk for the disease, they lack the access and the support to do something about it and to address it.
Before we let you go, any positive news about Alzheimer's research and possible breakthrough treatments that might give some people hope out there that could use some good news?
To me, hope is research, and the research is looking at the disease on a multiple myriad of fronts. So it's looking at risk reduction, it's looking at preventative strategies, it's looking at early detection of the disease, it's looking at treatments, it's looking at caregiving. There's 4 researchers from the Oklahoma area, and they're looking at a number of areas. I think they're involved in the health disparity area. I think they're looking at the caregiving area, because hopefully we want to get to a point where, yes, a cure, but wouldn't it be awesome if we could actually have a prevention of the disease, and that we can, if not prevent it, then at least detect it much earlier. Because what we do know is that by the time Alzheimer's and dementia presents itself in physical symptoms, it's actually been in the brain for upwards of 8 to 10 years. So if we can detect it earlier, we can treat it earlier.
And on that hopeful note, Peggy Killian, thank you so much for your time. Great information.
Thanks, and thanks for the time to talk about it. I love research.